I suppose if I look back onto what first interested us in quality improvement, in a similar situation to lots of other hospices, we were perhaps having staff saying to us, things are a lot busier, patient needs are more complex, we don't have as much time to do the things that we wanted to do with patients. So we started to think, actually, if we work within a limited resource, how can we do things smarter so that we can release more time so that staff can then meet what they wanted to achieve in terms of the quality of patient care, but also not put too much of a burden on the organisation. So we, as I say, looked outside our organisation, started to have some discussions with Airbus initially. They'd been doing a lot of quality improvement based around the lean model of improvement. And we had some great discussions and some tours around their factory in Broughton near Chester, and looked at how they'd implemented really small and simple changes around their factory that was scalable down to a much smaller organisation, but so that we could eliminate some of the wastes in terms of travel time that staff were experiencing and free up time for staff. So that was probably our first step. From that, we decided that we wanted to look for more information and knowledge for staff around quality improvement. We're very fortunate in Wales that there is a quality improvement network, and we were able to access training for staff at different levels of the organisation, but make it open and available to all staff. And I think that's been really important to us, that it is a cross-organisation programme, that it's something that's accessible to all staff regardless of what role they're in, and that everybody feels that they can make a difference because we're all working towards the same focus. So we offered staff the opportunity to do a really short online training known as the Bronze Level Quality Improvement Together training. And a number of staff took that up and sort of started to become interested. We then got a mixed group of staff together to use some of the tools, quality improvement tools that they'd learnt about. So they're great fun, just drawing simple things like spaghetti diagrams that mapped their route of travel around the organisation when they were looking for bits of equipment to carry out procedures. And we had a really mixed group, so it involved not only our nursing staff, our medical team, housekeepers, facilities guys. Everybody was able to work together on the same project and came up with some ideas which involved quite major changes in terms of room reconfiguration and equipment, but we invested in that, made some changes so that people could see there was a value to quality improvement. And that, I think, was really important as a first approach for us, so that we had a diverse group of staff and a significant size group of staff that had a taste of what improvement, the quality improvement processes could bring. Then we were ready to move on to the next level. And the training programme that I've mentioned, Quality Improvement Together, has a silver level training, which staff who are interested in leading quality improvement projects are able to access. It's a slightly longer training course, and as part of the course itself, staff are actually asked to identify a quality improvement project and to see that from the first initial idea through to implementation and measurement. And that's where we first got to be more involved with the quality improvement model, looking at the Plan, Do, Study, Act cycle, which that training programme is very much built around. So we had probably initially, again, 3 staff who did the silver level training, and then because as an organisation we were starting to generate a lot of interest, the trainers came over to the hospice and delivered the session to 18 members of staff simultaneously. So we then had 21 small projects going on within a small organisation. A couple of people joined together as they went on and started to work collaboratively between different teams. And it was, again, just small tests of change, introducing, measuring, sort of doing initial measurement, for example, on how many times patient lunch times were interrupted, and how that then led on to staff lunch times being interrupted, introducing protected meal times and seeing how we could improve that so the nutritional care of patients was improved, And actually we did some staff wellbeing with that as well, because we now know that staff consistently have a lunch break and they're not going to be interrupted on it. So it's been a great journey from that point of view, and fantastic to see so many different people in the organisation engaged in it.